If you suffer from chronic back or neck pain and have tried just about everything, there may be another option for you out there.
Dr. Christopher Miller from Total Health Chiropractic is here to share some information and to tell us about a free upcoming seminar, because you really have revolutionized chiropractic care.
Yeah, well, we take it kind of to the next step with more severe and chronic issues that we can help patients with. The common things that we can really treat are herniated discs, degenerated discs, bulging or ruptured discs, and many times with those problems they can get more than just back or neck pain. They may have radicular symptoms like problems down their arms or legs, and those could be like numbness or tingling, shooting pain, or just weakness as well. So we have a lot of new medical technology in our office, and it's just a unique way to approach these issues. It does not involve drugs or surgery, and it's just very safe procedures to really correct the problem, not just treat the pain.
I know that with people that have this chronic pain, a lot of times they've tried a lot of different things. How often do people come to you and say, I don't even know what the problem is anymore? Is that pretty common?
Very, very frequent. And that's really what this workshop is for, is that I started doing these last year, and we've been full every single one. But we want to really educate people what their actual problem is that's causing their pain. Because as I was telling you before we started this today, get a lot of people that have gone through all these different treatments, maybe even more than one surgery, and they still don't even know what really the problem is.
Frustrating.
So we want to clear that up for them so that they understand what's actually happening, and then talk to them about solutions for their problems.
And that seminar is coming up on January 18th. It's actually a free opportunity for people to come together and get information, but they really do need to call ahead to reserve a spot, because there are only 40 opportunities during this seminar.
We try to, I mean, that's the limit for the unit that we use. It's about 40 seats in there, and we just, it works very, very well because we try to keep it a little bit smaller, so that's more of a personal experience, and really try to get those questions answered during that seminar.
So if the phones are busy when they call, just wait 10 minutes or so and then call back. And
yeah, when people call to register, they might just ask them a couple questions to make sure that they would qualify for this type of workshop dinner, and it gets pretty busy. So yeah, if the lines are busy, please just wait 10 minutes and call back.
Tell us about the special technology that you use, which really provides so much relief for people who have exhausted all other possibilities.
Again, we use a variety of treatment options. A couple things that are unique to our office is we use a machine called the DRX 9000, and this is actually an image of our SpineForce 3D rehab machine. That's the DRX 9000. So these are, it's called true non-surgical spinal decompression, and that is really used to help alleviate these chronic conditions, and it really works on the discs, those pads between the bones, to pull these bulges back and away from the nerves, or rehydrate these discs to expand them so that they're nice and cushiony again, almost acting like a shock absorber again, instead of every movement they take just jarring and slamming their back and irritating things. But I've mentioned before, the goal is, number one, get these patients out of pain. Then we want to help them so they can function again and get control of their life and be a productive member of society. And then we want to teach them things they can do to maintain that health on their own, so they don't have to keep coming back.
You touched upon SpineForce too, and we do have some video of how that machine works. What exactly, or what role does that play in the treatment for people?
Well, that's usually not something we start with. We try to address and correct the actual cause of the problem first, but if you just stop at that point, chances are things could go back to how they have been and then have those problems again. So we want to follow through with some rehab to work on all the soft tissue and surrounding structures. This is very efficient at working the 180 deep core spinal muscles and getting those conditioned and in shape very efficiently. And it's not the normal kind of workout or rehab. It's a fun way of exercising. I think it's just kind of like that Nintendo Wii, where you're interacting with the machine. It keeps challenging the patient without doing so much that's just overwhelming, and they just feel they can't continue on with that.
Right, and this is a technology that's unique to your office.
It's a rare piece of equipment. It's made in France. There's under 100 of these in the United States, and there is only one other one in Michigan. So both the DRX 9000 C with the cervical unit and the Spine Force machine, we are the only facility in West Michigan with either of these. And I have the most practice with these. I've been doing this for 4.5 years. So we know how to help these people.
Well, that's great. This is a great introduction, and it would be great to learn more. So let's recap. Next Tuesday evening at 6:30, AIM Fitness is where it's going to happen, but they need to call ahead of time to reserve a spot.
It's a workshop dinner, so please call my office at this number, and my staff's ready to go take those calls and get you registered so that you can come on out and learn a little bit and get your life back on track.
Which is really great, because I know a lot of us have made New Year's resolutions that involve some kind of physical activity, and boy, for some people that's just not even a possibility because they're in such excruciating pain.
It's tough.
Yeah.
You get backed into a corner, and this is, for many people, a first step out of that so that they can enjoy their life again.
That's great. Well,
Changing
thank you
lives.
so much.
Thanks,
Fantastic.
Dr. Miller.
Thanks again.
We appreciate it. We'll be right back.
Are you West?